I have a few questions to start off our panel discussion, and then I will turn it over to all of you. But as a moderator, I get to go first. As a reporter, I get to go first. And I will open this up to whoever wants to address it. I will say first and foremost that I know that the topic of today's conversation is not antibiotics or antibiotic resistance or things of that nature, but there's kind of a thing that I have to ask. I'm wondering if any of you could speak to what could come next for FDA, as it has been mandated to complete a court order to conduct its own review of the health and safety effects of drugs like tetracycline and penicillin that have been administered in subtherapeutic doses for livestock. Anybody? Okay.
I don't have to stand up here. I don't have to stand up anymore. You can all
No,
see
just
me.
me.
Press the push button.
All right. Well, so I just want to reiterate a couple principles that AVMA stands by when it comes to antimicrobial resistance. And I know that this is a huge issue for public health, but I wanted to talk about two resolutions that AVMA passed that really go to the foundation and the basis of this. First of all, the AVMA discussed this at length. This is before that directive came to FDA, where veterinarians, I'm going to read this because I want to get it exactly right, veterinarians should work with those responsible for the care of animals to use antimicrobials judiciously, regardless of the distribution system through which the antimicrobials are obtained. And secondly, first principle, secondly, veterinarians should take a part in the decision-making process for the use of antimicrobials in animals. The third point I want to make that gets more to that, Amber, is that because of the concern that veterinarians have more oversight over the use of antimicrobials, so that we can make sure that we still have them available for the health and welfare of the animals, but also for the health of the food supply, is that we set up a steering committee to work with FDA on policy to improve veterinary oversight of antimicrobials. And certainly we have a concern where there was an FDA directive to eliminate cephalosporins even for use in food animals, but the most recent directive that eliminates the extra label drug use for those antibiotics is certainly less restrictive. Our biggest concern with AVMA is that there will be decisions made with lack of scientific support and information that will result in a worse system than we have right now. We are always thinking about public health, always. And as Dr. Navarro said, the most important thing to our producers and for our food animal veterinarians and for the public is that we have a safe food supply as it comes to antimicrobials. So I'll leave it at there to start with, and I don't know if anybody else has comments.
Yes.
Everybody hear me? So yes, I definitely, AVP supports what AVMA has done. And I share that sentiment that one of our fears is that we make decisions based on fear and not based on science, and we have increasing food prices, which is a human health issue, without much gain because of some of these things that are put in. And so that's a big concern of mine. The other concern of mine is that we've got so much focus on agriculture, and obviously we should continue to look at that. We need more research into this area. But I don't want us to forget that everything that we do, from using hand sanitizers to when I was going through security yesterday in the airport, I look down and I see antimicrobial floor mat. We have microban impregnated countertops. You know, everything that we do that affects these bacteria, affects our lives, and we need. As a mother, this is definitely a professional issue for me, but as someone who feeds children and wants to feed them safely, we definitely care about this, and we need to look at the entire picture and not try to just think that focusing on one area is going to fix the problem.
Okay. And this sort of seems kind of appropriate for today's discussion. In talking with each of you yesterday, it sort of opened my eyes. There are a lot of connections to public health that veterinarians play that I just didn't think of. So what would you say is the biggest misconception about a veterinarian's role in public health? And yes, that is intentionally broad.
that we don't have much of one. I think that some of the statistics and all of us coming up here today have, I think it goes to show that we have multiple roles, and even if you are in small animal practice and doing pet practice, that you're doing public health. So, okay.
Go ahead.
I was just going to say that it's a good question, because one of my passions for even seeking this office was because of the misperception of what veterinarians do, who we are and what we do. Because actually, most of the human public sees veterinarians associated with their animals, their pets primarily. And that there's a silent majority out there that is working every day in public health. Even as small animal practitioners, we don't see the public health role that we're playing unless we specifically identify it to people. It's present every day. That's the biggest misconception, that veterinarians don't deal with human health. And we do deal with human health in a number of ways, as you've heard.
Amber, I think, well, first of all, just look at the panel and the array of activities in which we're involved, but secondly, our role in public health and the activities in which we engage is made possible through our training and education, and we are uniquely qualified to gather information, gather data. It doesn't matter what the issue is. When I came to Washington 7 years ago, I was a congressional fellow, and I worked for Senator Chuck Hagel, and they gave me the Superfund sites in Nebraska to manage. And I'm thinking, oh my goodness, I don't know anything about this. But I was able to gather the data, I assimilated the data, came to an understanding about it, and then I was able to come to a conclusion and convey that information to my peers in the office and those for whom I work. So I think our training enables us to be engaged in a vast array of different activities, and certainly public health is not the least among those.
You know, they've said this so eloquently, but we are the ultimate clinician. And, you know, our physician counterparts come to us and say, gosh, you have a challenging job or a career path or an educational path, because I only had to learn one species and you've had to learn how many. So I just think that that's a misconception, and something that I'd like for you to walk out of here understanding that we understand multiple species, and while we haven't trained specifically on the human species, why do we use animals, or our interface with animals tells us that they are very much like us, and so our understanding of their health, of their zoonoses, the things they can pass to us, the things we can pass to them, is very relevant for all of us that are sitting in this room today, and the many roles that we can play in public health and defending this nation.
All right. What would you say are the biggest challenges facing veterinarians in protecting human and animal health? So it's so clear there is an intersection between not just human and animal, but also the environment.
I'll start with that. Let me make sure I get the question right. The biggest challenge for veterinarians in assisting in public health service, is that what?
Protecting human.
I think from my own standpoint, one of the biggest challenge I see is that veterinarians really fill two roles. They fill public practice and they fill private practice. Private practice really is working with individuals who own animals, and money is either discretionary or plentiful, depending on who your client is. The biggest role and challenge is continuing our role in public health. And because I believe that we're uniquely educated for that, the public practice sector of veterinary medicine is many times vulnerable to budgeting and appropriations, government. And those roles, I think, are vulnerable because of our constant budget constraints and our economy situation. I think that is the biggest challenge now, and why I'm so glad we're here is because the general public does not understand the significance of that role that we play in safe food, in keeping transboundary diseases now, as they're called, out of this country, protecting international trade, protecting our commerce. that is so many times subject to budget constraints. And unless there's a crisis, then we deal with it. But humans are very short-sighted. And as soon as the crisis is over and we put new systems in place and money gets tight, the money comes down again. And it's until we get another crisis. The hard part is retaining the urgency for prevention in the first place. That's my biggest challenge and frustration.
I'll take this next, just the shrinking of our veterinary workforce. This is something that we're talking about strongly within the federal government, but across our profession. We are the ultimate clinician, and yet our numbers are shrinking, and within the profession as a whole. And within the federal government specifically because of the shortage of veterinarians within our career field. And so we play critical roles in the public health of this nation, and we're really talking together and dialoguing internally as a profession. How do we address this? We want to be able to meet what the public demands of us and what we know we can bring to the table, but it's encouraging young individuals to come into the profession and then encouraging them further to take an interest in a public health role, because that even specializes them a little bit further and thinking about the role that they play in public health through private practice, but entering into some of the federal service areas where we have a specific role for food safety and monitoring that within the health of the nation. So,
Enthusiastic new veterinary graduates will transform the face of our profession, I believe.
All right, I'd like to open up the floor to questions.